very good afternoon, and thank you so much for joining us at this time. You're watching News Analysis live on Politics and Business TV. Today is Thursday, the 21st day in the month of March 2024, and of course we know that March 20th of every year is World Oral Health Day. Of course, that was yesterday, but today we come asking you a very vital question, which is, when was the last time you changed your toothbrush? I will be having a candid conversation with a consultant, family dentistry. He's right here in the studios. And by the way, I am Omoife Peace Osemere, a breather. We'll be back in a moment. Do join us again. Right, welcome back. This is News Analysis live on Politics and Business TV, a global event that aims to help reduce the burden of oral diseases which affect individuals as well as the health systems and economies. World Oral Health Day is observed on March 20th every year. The theme for Oral Health Day 2024 is "A happy mouth is a happy body," and this day is used to create or raise awareness about the importance of good oral health, and also to urge schools, educational institutions, youth and policymakers to promote good oral health for all. Well, according to a global oral health status report published by the World Health Organization, 3.5 billion people suffer from oral diseases, with 3 out of the affected, or 4 out of 4 affected, living in low and middle income countries. This is reportedly an indication that cases of oral diseases have increased in over 3 decades. The Director General of the World Health Organization, Dr. Tedros Ghebreyesus, said oral health had long been neglected in global health, but many oral diseases could be prevented and treated with cost-effective measures. Ghebreyesus said gum diseases, tooth loss, and oral cancers are among the most prevalent oral diseases, while tooth decay is the single most common condition around the world. Joining me now to discuss this is Dr. Nathan Ikimi. He is a consultant, family dentistry, and apparently he is a member of quite a number of associations. First of all, he's a member of Nigeria Dental Association, NDA, and also member International Association for Dental Research, and lastly, member Nigeria Medical Association. Dr. Nathan, thank you so much for joining us.
Thank you for having me.
And should I say Happy World Oral Health Day?
Thank you very much.
I see the polo you are wearing is actually branded, yes, and it has the theme on it. A happy mouth is a happy body.
Yes.
Let's not also forget, dear viewers, that yesterday was also, you know, the International Day of Happiness. And I do hope sincerely that you all out there are staying happy. Now, coming, you know, to the topic of discussion today on News Analysis, which is about oral health and why it is important. Let me start by asking you, what are the common oral or dental diseases in Nigeria?
Yes, commonly we have the dental caries, then we have the periodontal diseases, that's the infection of the gum. Sometimes the gum becomes swollen. Sometimes you hear somebody says he's brushing and the gums are bleeding. Sometimes the periodontal disease. Those diseases can easily be preventable. That is what this World Oral Health Day is all about. Preventing diseases so as to reduce the burden of oral health diseases. You know, when these diseases that are easily preventable are not, in children and even in adults, it can affect your chewing, your eating, it can disturb your sleep, can cause pain, and for children it can prevent them from school. They will not be able to concentrate. And for adults, they spend a lot of time, that they use in their office, they spend it in the clinic, in the hospital, trying to seek help. So these are preventable diseases. So the advocacy, the oral health awareness we are doing this period is to tell everybody that these diseases are preventable, just visit your dentist at least once every 6 months.
All right. How important is oral health, to the well-being of an individual?
Yes, the oral health, like the thing this year says, a happy mouth is a happy body. It's trying to tell you the connection between the mouth and the body. There are some diseases, most diseases of the mouth, they affect the health. Diabetes, heart problem, they all affect the heart. Pregnancy, cancer, they all, if you can take care of the mouth very well, you find out that the body will also be good. For instance, diabetes, research has proved that there's a bidirectional relationship between the state of your mouth and your diabetics and the state of your diabetics. And that once the mouth is kept clean, the response to diabetes treatment is better.
Okay.
Yes.
Well, that is an eye-opener, one must say. But how is it that, we have people who brush their mouth twice or even thrice a day, but they still complain of, this awful, smell oozing out of their mouth.
Yeah.
So the question now would be, how many times should one brush in a day?
Yes. When we talk about toothbrushing, you have to do it right.
Okay.
It is not just running the brush through the mouth. No. You have to brush for at least 3 minutes. Yes. And then the wrist roll technique. You touch the whole corner of the mouth very well. And then your brushing should be after breakfast.
Oh.
Not before breakfast.
Okay.
After breakfast, and then last thing in the night.
But how many Nigerians adhere to that? How do you convince an average Nigerian that you have to brush your mouth after breakfast?
You have
and the last thing you do before you go to bed at night?
Well, if you value your health, you have to do it. I didn't learn it from childhood, though my children are getting used to it from childhood. I learned it when I got to the dental school, and it is part of me now. So if you value your health, you will do it.
Okay,
yes.
So for early birds, people will go to work very early in the morning, and time will not even permit them to have breakfast in the morning. They would have to brush their mouth, before even having breakfast.
Yes,
so what do you have to say about that?
What I normally advise my patients is that some of them, they tell you they eat late breakfast. Now, when you brush last thing in the night, when you wake up in the morning, the mouth is still clean. What causes mouth odor is the degradation of food that remains in the mouth. Now, before you sleep, you brush the mouth clean. So throughout your sleep, it was just saliva. So you wake up in the morning, if you want to just create the impression that you brush, rinse your mouth with warm water, go to your work. After breakfast, take your toothbrush. Take your toothbrush with you. After breakfast, you brush at your office. There's nothing wrong with that.
What do you have to say about these, a handful of liquid mouthwash that are out there in the malls, the, stores and all of that? How effective are those mouthwash?
Yes. For me, some people tell me that they take the mouthwash, it gives them good breath.
Okay.
I'm not against mouthwash. I'm not against mouthwash, although I don't recommend it. But then, if the mouthwash, there's nothing detrimental about using mouthwash. But if you have the money to afford a mouthwash, go ahead and get it. But then the best thing is your toothbrush and your toothpaste. A toothpaste that have fluoride.
Okay,
yes.
So it means if one is going to get a toothpaste, for example, there are some stuff that one must look at for, right?
Yes.
It must have, or it must contain the fluoride, or what do you call it again?
Fluoride, yes.
Okay, fluoride.
Yes.
Now, this is an old toothbrush, right?
Yes.
The question we're asking our viewers today is, when was the last time you changed your toothbrush? How often should one change, their toothbrush?
We recommend that you should change your toothbrush once in 6 months.
I thought it's once in 3 months.
Yes, in 6 months.
Okay.
But then, you have children that they chew their toothbrush. Like, can I have this your toothbrush?
Sure.
Like this toothbrush. When you see a toothbrush that bristle is scattered. It is no longer effective.
Okay.
So for my son, I change his toothbrush once in 3 months,
Okay.
more often than adult. While the other adults in the house, they change theirs once in 6 months.
Okay.
Yes.
So how are we supposed to brush our mouth in such a way that, you know, the bristles on the brush won't, you know, get tampered with easily? I mean, there are people who love to scrub really hard.
Yes, we always recommend soft or medium. Now, you know, when those in the villages, when they brush with hard toothbrush,
Yes.
and then the blood comes out, they say, yes, they have had a good brush. We are destroying the gum.
Okay.
Yes, we are destroying the gum. And later you find out that you've pushed the gum up, and then the teeth are just protruding out, and they become mobile. So we recommend the wrist roll technique. You massage the gum. You don't brush with force. You don't even brush the tongue as if you want to vomit. No. The tongue is an important organ. You should always brush, because 90% of the bacteria that causes mouth odor reside on the tongue.
So if you're using a toothbrush that is not hard, how are you supposed to scrub the tongue?
You scrub the tongue. You brush the tongue with the toothbrush, like this. That's how you brush it.
No, but if the toothbrush, if the bristle is not hard, it might not really be able to scrub out, you know, scrub off the
dirt. Not hard. Because you use a hard toothbrush, your tongue might bleed.
Yeah.
We don't want you to injure your tongue, please.
Okay.
Use a soft toothbrush, soft bristle, or medium texture. You brush your toothbrush. Make sure there is sufficient toothpaste on it, and then brush. You do a good job of it.
Is it safe to swallow the toothpaste?
Well, children swallow toothpaste. You cannot prevent them from swallow toothpaste. That is why we have children toothpaste, and the concentration of fluoride is less in their toothpaste.
Okay.
That is why we do that. But in a family, you know how the economy is. In a family that they cannot afford to buy children toothpaste for children, we tell the parents that to monitor the brushing. Don't just say go and brush. Monitor it.
Okay.
The child can be 10 years old. Please monitor the toothbrushing, please.
Okay.
Yes.
All right. Let me have that. Well, I purposely came, you know, with this toothbrush. I used this a couple of months ago. And thank you for, you know, changing, you know, my mindset and perception that it is once in 6 months that we're supposed to change our toothbrush. I change mine every 3 months.
Beautiful.
Every 3 months.
But
now
good.
Toothbrush is so expensive.
That is
toothbrush is, yes, it's so expensive now.
Yes.
So once in every 3 months is perhaps not really too realistic for a number of us anymore. But now the next question would be, how is one supposed to brush? You know, we've seen video, you know, illustrations across, you know, social media platforms. Some will say you brush up and down like this and not like this. So what is the ideal way to brush the teeth?
Now for children that have not achieved the dexterity of moving the finger, we just advise brush like that. At least you are brushing. Sometimes we just say put the toothbrush, move your head.
Okay.
You know, for children.
Yes.
And then you brush the biting surface of the tongue, of the teeth. You bite it, then you brush up, then you also brush the inner. It's a pity I didn't bring the model to show you proper. But then for adults, the wrist roll technique, you start the brushing with the tooth like this.
Okay.
And then on your gum, here.
Yeah.
Then you massage it down. You massage it down.
Okay.
Then you go down too, you do this down, you massage it up. You massage it up. You massage it up.
But
you know the advert.
That would take a lot of time.
That
would take a lot of time.
That is why you have to watch 3 minutes. The advert that they do that, is it up to 30 seconds? That is for advert. So if you have to spend 3 minutes, at least 3 minutes, enjoy your toothbrushing. Feel it. Enjoy the massaging of your gum. Enjoy it. Okay. Yes.
All right. Thank you very much. So, as a dentist, what are the cases you come across often, and how often are these cases presented?
How often?
Yes. Are these cases presented?
Cases of dental caries?
Yes.
It's like an everyday thing. It's quite often we have a lot of cases of dental care, pain especially. But you know, in Nigeria, you ask somebody to come for to go for checkup. Probably because of the economy, they don't always come for checkup. Most of the cases is that when the person has pain, it is sometimes you'll be surprised that you just see a patient that came and said he's here for checkup. That is rare. Most of our patients come when they have pain, and because of the economy.
Which means it's very expensive.
Yes, I'm not in a private practice, but it is quite expensive in the private practice. Though the government hospitals are also doing well, but this advocacy, we are advocating that dental treatment should be included in primary health care, not secondary health care. The government has done well by putting it, expanding it in the National Health Insurance Authority. They've expanded it, but it's still in secondary care level. Go to any health center, community health center, you will not see a dental, personnel there.
Well, that means the government has not done enough.
We are getting there.
Okay.
That is what this oral health week is all about.
How long will it take to get there?
Gradual. Okay. We are making progress.
Oh, really?
For instance, Noma, that canker orange that has been causing a lot of in the north here. The government has already fought and included it in WHO list of neglected tropical disease. So the government is doing well. They are trying. But then you come to places like in the north here, we have a lot of schools bringing out dental therapists, dental auxiliary staff. Use these staff. Send them to community clinics. They can teach, demonstrate toothbrushing. They can do scaling and polishing, preventive. They can put simple filling of glass animal cement in children. They can also do simple extraction. When these are done, then maybe you will have one dentist that goes around the circuit that takes difficult cases. You see the burden of oral health care will reduce. If I ask you now in your village, is there any, in the community health center, yes, you have in your village, but is there any dental personnel there? You probably do not. So we are not saying put the dental chair. We know it's quite expensive, but gradually send dental personnel there, send dental therapists there, dental auxiliary staff. They can do simple scaling and polishing.
Okay.
This prevent caries. They can do fluoridation of water. They can give oral health instruction. So simple things. This will reduce the burden of oral health care. Imagine in country in Nigeria, the ratio of dentists to a patient is 1 to 53,000.
Why is that?
Well,
we don't have people who are passionate about dentistry. Is that a
problem too? Few dentists. Then the dentists are not going to the rural areas. Then the auxiliary staffs that are there, they are not being sent to the rural areas. Then we know the Jackpot syndrome.
Yeah.
So all these are making the number of patients in dentistry quite much.
Indeed, thank you so much for that insight. But another question I would like to ask you is, if you go to rural areas, the villages, where people cannot really afford a toothpaste, they use this chewing stick, like our forefathers and mothers did, back in the days. But is that okay?
Yes, what we advocate with the use of chewing stick is that chew it to a pulp. You chew the chewing stick to a pulp before you use it. Use it gently, because if you now examine the teeth, researchers have shown that those in the village, when you see their teeth, they have what we call gingival recession. The gingiva has moved up because of the vigorous way of brushing, and the teeth are all coming out sharp and they become mobile. They easily fall off. So what we advocate, chew your chewing stick to a pulp before you use it gently, not vigorously.
So is it also okay for one to use the chewing stick on the tongue?
When you chew it to a pulp, you can also follow the system of massaging it from your gum level.
Okay.
But it has to be demonstrated to them. So that is why we need more dental personnel. We need to carry this advocacy to the rural area, create awareness too.
Okay, so in the course of this, World Oral Health Day, what exactly are you? I mean, you're a member of a number of associations, the Nigerian Medical Association. What are you doing, to commemorate this day?
There's this new program by the Nigerian Dental Association in collaboration with Unilever, the producers of Pepsodent and Close-Up. This Meet the Dentist, Speak with the Dentist program. This is what the Nigerian Dental Association, they are doing. They are carrying that program to the rural area to give free checkup. They do free scaling and polishing. They do free extraction. So the Nigerian Dental Association is doing its best to get to the rural area with this program that is sponsored by, that is being supported by Unilever. So what we are trying to say is that other corporate organizations should come and join and then encourage the dentists and then let us go far. We can do it.
Indeed, we can. Is it also safe to, floss the teeth? And how often is one supposed to do that?
The floss. If you finish eating, use your floss. If you finish brushing, use your floss. It is very important to floss. Now, some people use this toothpick.
Yeah,
you see them.
The wooden toothpick.
After they finish drinking pepper soup and bushmeat, they now use the floss, digging between the teeth. That causes what we call pocketing. It creates a pocket. Because as you are digging it, you are destroying the periodontal fibers around that holds the teeth. Like a tree, then the roots, the roots. Now, those toothpicks now destroy these roots, holding the teeth. And then when the pain starts, you think it is your village people that are after you. They are not. So you have to really we discourage the use of toothpicks. Okay.
So to wrap up the conversation now, I've heard a number of people say that it's okay for you to chew ginger and garlic, to enhance, this fresh breath. How true is that?
Fresh breath?
Yes.
Yes.
Ginger and garlic, can it actually help to, enhance fresh breath?
Toothbrushing gives you some fresh breath. Those who use, I don't use mouthwash.
Okay.
But my wife has not complained about my breath. She's the closest person to me.
Yeah.
I just use toothbrush and toothpaste.
Okay.
So, yes, there are different things to create fresh breath. But I think it boosts the confidence of the person that has fresh breath. Because some people just complain to you, they come to you. I've had patients that they come to me, they say they have mouth odor. When the patient had finished complaining, I said, who told you? He said, he saw whenever he's talking to some people, they'll do their nose like this. I said, you don't know if it is a habit with that person. You don't know if the person has cold. Is it your husband that told you? No. Is it your father? Is it your mother? It is when a close relative tells you that you have mouth odor, then we can address it. Because sometimes it's just psychology.
Okay.
You just see the person pick his nose, you said the person is looking at you, the person thinks he's saying that you have mouth odor. You're not. So, but then, that is where this fresh breath comes in. This fresh breath sort of boosts their psychology. It makes them feel good. We are not against that.
Well, I actually would have loved to ask you if my breast is actually fresh. But since you're not a relative, I'll save that question for another day. Well, I'm afraid we have to leave the conversation here now because of time. Dr. Nathan Ikimi, thank you so much for talking to us. Right, Dr. Nathan Ikimi is a consultant, family dentistry, and also a member of Nigeria Dental Association, NDA, a member, International Association for Dental Research, and also member, Nigeria Medical Association. That is it for News Analysis today. We do hope that you learned a thing or two. And please take note that the theme for this year's Oral Health Day is a happy mouth is a happy body. Thank you so much for watching. I am Omo Ifepiso Semer. I'll be back in a moment with the news update. Good afternoon.
Can I give you my email?